Thank you, Tracy. Well, it's time once again for Medical Mondays on the Vine with Baptist Health. This week we want to talk about women's health. Ashley King spoke with Mandy Burton, who specializes in the unique conditions that impact women, especially during menopause. Check this out.
Listen up, ladies, especially if you're experiencing menopause or even if you just know someone that is. We're here to talk to an expert on this field because there's a lot that goes into it. So we're at Baptist Health to talk to Mandy Burton about GSM. First of all, there have been some changes when it comes to the guidelines. So what exactly is GSM?
I'm glad you asked. So GSM is genitourinary syndrome of menopause. So it used to be called vulvovaginal atrophy or even senile vagina. So GSM, it was changed back in 2014. The name was changed in 2014 because we know that menopause affects the pelvis, and in the pelvis we have the vagina and the bladder. So this is really the things that can happen, the negative things that can happen in the pelvis when you are in menopause and if it is not treated.
Right, and so that can be very, very difficult to deal with on a daily basis, I'm sure. And so what exactly is a medical society guideline?
Yes, so the AUA, which is the American Urologic Association, has just released new guidelines concerning GSM. And so this is an association that tells us how to treat certain conditions, okay? So evidence-based. And so this guideline has taken 6 years to come out, and by the way, this is the first sexual medicine guideline for women that the AUA has done.
So who is on the panel that decides these guidelines?
Yeah, so it was interesting. So there's not any gynecologists. So you think gynecologists would have some say in these new guidelines, but there was not one. So it's urologists, urogynecologists, ISWISH, which is members of the International Society for the Study of Women's Sexual Medicine, the Menopause Society providers, and even a patient advocate was on the provider, was on the panel list.
So a wide range of people on this panel. And so tell me, who does GSM actually affect?
So it will affect 100% of women.
Oh, wow.
So there is not just one symptom. There are about 10 symptoms of GSM. And so the symptoms are urinary frequency, urinary urgency, leakage, changes in the feeling down in the pelvis, recurrent urinary tract infections, changes in dryness.
Right. Being a woman can be very complicated.
Yeah.
I mean, as a woman, you know, I had, and being of age, you know, where they start to do the perimenopause and the menopause, I mean, I feel like I'm learning something new every day. And you would think, you know, I'm a woman, I should know these things. But I'm so glad that there are people like you that can walk us through this. And tell me too, because vaginal estrogen, you know, people are afraid that can be linked to cancer. I mean, is that something that is a real concern?
Yes, so every day I hear in the clinic, oh, I can't take estrogen, I have a history of breast cancer. Well, these guidelines say differently.
Right.
So vaginal estrogen is safe for you if you have had a stroke, a blood clot, have had cancer, breast cancer. I would dare to say vaginal estrogen is safe for every woman on this planet.
Right.
At any age.
Yeah, and I mean, there's a lot of relief knowing that there are treatments out there and that it is safe for those that are suffering through those symptoms. So what can you tell women who read the black box warning, you know, on the vaginal estrogen package, because they're seeing that and it causes concern there?
Yes, so I prescribe vaginal estrogen to every woman that walks through the store. And probably about 30% of those women are going to read every package insert that they get at the pharmacy.
It's scary with any medication you take, though. You know, there's always something.
On the package insert, though, it says that you will have breast cancer, blood clots, probable dementia. And so we know that this is not true based on these new guidelines and the research. So we are actually petitioning the FDA to get this black box warning off of vaginal estrogen.
Oh, wow. Yeah. So there's a lot to know when it comes to menopause and to GSM. And if you've if you have any of these symptoms, here you go. You can talk to Mandy Burton and the great staff here at Baptist Health. So make your appointment today, baptist-health.com.